is a little different. It's going to be a tribute video to the man who started it all, the founding father of microbiology, Louis Pasteur. The species we're going to cover is Pasteurella multocida. The title, Louis Pasteur's lab. So the scene takes place in Louis's lab. And here's Louis and his lab. But that's not why we've titled it Louis Pasteur's lab. We actually mean lab as in Labrador Retriever. This is because Pasteurella is found in the respiratory tract of small mammals, like cats and dogs. Multocida is more commonly found in cats, and Pasteurella canis is more often in dogs. But really, both pets can harbor Pasteurella multocida, and for this reason, the most common cause of transmission to humans is dog and cat bites. So let's add Pasteur's pet lab, Ella. Get it? Pasteur and Ella, Pasteurella. And Ella will have just bitten Louis's arm. Now that she's bitten his arm, it's already beginning to turn erythematous, and it looks like a soft tissue infection or cellulitis is setting in. We're showing it happening immediately after the bite, but generally it occurs within the first 24 hours. Of course, soft tissue infections can be relatively benign, but there is the possibility of it developing into a necrotizing fasciitis, or more commonly the possibility that the infection may spread to the bone, causing osteomyelitis. To represent osteomyelitis, we'll use our fishbone symbol, which is our recurring symbol, and we'll have Pasteur holding the fish bones and teasing the dog with them. I guess you kind of deserve to get bit. So Pasteurella can also cause lymphadenopathy and spread systemically, but generally this only occurs in people who have predisposing conditions, like liver disease or COPD. So we didn't really think this was high yield enough to bother remembering. The main associations you should remember are cellulitis and osteomyelitis after dog or cat bites. Okay, we're done with the clinical features. We knocked those out first. Now let's get to the microbiology and lab features of Pasteurella. So first, it's catalase positive. So we'll add our catalase cat here. It's nice that it's catalase positive because this can also help reinforce that Pasteurella can be spread by cat bites as well. It's also oxidase positive. So we'll add our oxidase positive blue ring to Louis's hand. Pasteur's most famous lab instrument was the swan neck flask, and we have it drawn here. We only included it because we thought it looked really cool and it's a nice little historical fact. But we're also going to encase it in this glass capsule, and that's because one of Pasteurella's important virulence factors is its capsule. And now our capsule symbol definitely looks like some old piece of lab equipment. Pasteurella grows well on 5% sheep's blood agar. So we'll deck out Louis's lab with bottles of sheep's blood. And this seems like such a simple agar, I wouldn't be surprised if Louis actually used it way back then. When observed under light microscopy, Pasteurella is said to demonstrate bipolar staining, or safety pin staining, which means it takes up stain most readily at its two ends. This is just like Yersinia. Remember the safety pin on the infant's diaper in the pet shop? Well, we'll add the safety pin here too, and this time we'll use it to keep Pasteur's white coat closed. The empiric treatment for Pasteurella is extremely simple. It's penicillin. We'll add a couple penicillin pencils here to help you remember that. In addition, you may want to use a beta-lactamase inhibitor to help prevent resistance. So maybe a good combo would be amoxicillin and clavulanic acid. And that's it. There's a quick one. I really like this drawing. It's so simple and literal. It gets the job done. And I hope it would make good old Louis happy.